House Leader of Third Party.
Mr. Speaker, healthcare continues to be a top priority of my constituents. On this health minister's watch, the emergency room on the Saanich Peninsula is closed indefinitely in the evenings, and walk-in clinics are closed or closing. On Salt Spring, there is a critical lack of family doctors, no walk-in clinics, no UPCC, or the long-promised team-based primary care network. So the ER at Lady Minto becomes the de facto healthcare for all. On Saturna, residents are in a frustrating healthcare bureaucratic vacuum. This minister celebrates spending more money and gets worse results. It's my constituents and the people who are working on the front line that are paying the price. Through you, Mr. Speaker, to the Minister of Health, when is he going to admit his approach to delivering the results for the people of this province is not working?
Minister of Health.
Well, thank you, Honourable Speaker. Last year we put in place a Health Human Resources plan, one that is delivering for British Columbians. More than 5,300 more registered nurses, more nurses, I should say, registered this year with the College of Nurses, not my statistics, the facts from them. 564 international medical graduates approved this year. 66 primary care networks in British Columbia, and supports for communities across BC. There are challenges. There are challenges in many communities, but the way to resolve those challenges is to increase the level of staffing across our system, to recruit more nurses, and to retain more nurses by supporting them in the workplace. And that's precisely what we're doing in his community and across BC.
Member supplemental.
Access to healthcare is not improving in my communities. Access to healthcare is getting worse in my communities, and from what I'm hearing from British Columbia and communities right across this province. This morning, the government caucus heard about, from the nurses about the dangerous impact that staffing shortages is having in their workplace. I've heard how chronic nursing shortages have left patients unattended. Seniors are left stranded in their beds with no access to washroom or shower facilities. Families are hiring private care aides for their loved ones in hospital. My office is managing way more files than we should be, that should be dealt with by the patient quality care offices, but yet no results there. Patients are unnecessarily filling hospital beds because doctors are reluctant to release them back into the community because there's no care for them there. Hospital staff have approached me exasperated, devastated, traumatized, and fearful of speaking out because they don't believe this minister when he says they're free to speak without reprisal. In 2016, the ministry spent $17.95 billion on health care. In 2022, same ministry, different minister, $26.38 billion. Yet somehow we have worse results. My question through you, Honourable Speaker, is to the Premier. The Health Minister spends more money for worse results. It isn't working. At what point will this Premier say enough is enough?
Minister of Health.
Well, thank you, Honourable Speaker. And I did meet with nurses this morning. And British Columbia is leading North America, one of the leading jurisdictions in the world, in establishing nurse-to-patient ratios. We're doing that by working with nurses, by developing plans and programs, working with them to recruit more, and they're having some success. And those are directly funded. The member will know that. In our agreement with the Government of Canada, $750 million for nurse-to-patient ratios over the next 3 years, and in our collective agreement. More funding for nurses, for education, for leadership, more funding for opportunities for laddering in nurse communities, more funding and support, $60 million to support nurses in the workplace, Honourable Speaker, to support issues and challenges that they're facing in the workplace. This is practical, tangible action, and we're not doing it as we did with doctors. We're not doing it on our own. We're doing it by working with nurses, and that is the way to get solutions for patients, Honourable Speaker.